Hi, everyone. This is Shelley Fold-Nasso, CEO of NCCS.
Hi, this is Lindsay House. I'm the Senior Policy Manager.
Thank you very much for joining us today. I know it's a busy time of year as we get close to the end of the year and the holidays, and there's quite a bit going on here in Washington, D.C., as you may be following in the news. But we wanted to take a few minutes to update you on things that we've done this year at NCCS and some things that we are planning for next year. And also just to thank you all for all that you do to advocate for cancer survivors and to help NCCS with our various different projects. So we are going to give a little bit of an overview of the CPAT program just because we've had quite a few new people join CPAT over the last few months. And so we just wanted to share a little bit about what we do and why CPAT is so important to us here at NCCS. Our goal at NCCS, our purpose, is really to advocate to transform the healthcare system for the nearly 17 million cancer survivors and their families. And we do that by impacting policy, empowering survivors, and transforming care. This photo is from our CPAT Symposium in 2018, a group of medical students who joined us, and we'll be talking a little bit more about the symposium coming up. So for those of you who are new and some of you who are longtime CPAT members, our CPAT is our amazing group of advocates, over 400 advocates from around the country. And our goal is really to keep you all updated on what's going on here in Washington, D.C. in terms of public policy and ways that you can get involved, and really to learn from you, too, what's important to you and to cancer survivors that you work with around the country. So we have a monthly newsletter, e-newsletter, the CPAT Chronicles, that comes out in the first week of the month. And we try to share in the CPAT Chronicles any updates about what's going on here in D.C., what's going on at NCCS, some of the activities of advocates around the country in our network, and then opportunities for education and engagement. We try to share information about different opportunities that we learn of, whether they're NCCS opportunities or opportunities with other organizations. And what we would love for you all to share with us when you know of opportunities that we could help promote. And some of you have done that, shared and given us information about opportunities with regard to research advocacy or different kinds of programs or applications that advocates can participate in. So at the bottom of this slide, you see some of the examples. These are just, in this year, examples of programs that we have nominated CPAT members to participate in, and people have been accepted to participate in these programs. The Department of Defense Congressionally Directed Medical Research Program does peer review for the research grants through that program, and we've nominated a number of you all as survivors to participate in that research. And we hear it's an incredible experience. You really get to learn about the science and weigh in on what's important to cancer patients and cancer survivors in terms of shaping the direction of research. We've nominated people to attend and participate in the National Breast Cancer Coalition's Project LEAD, which is a one-week intensive program to really delve into the science of breast cancer. AACR, the American Association of Cancer Research, has a Scientist to Survivor program at their annual meeting in April and also at some of their smaller conferences throughout the year, including their Disparities Conference and others. And anytime we hear of the opportunity for that, we share it with you, and we've nominated a number of you to participate. They give scholarships to attend the program, and you get to spend a lot of time with the researchers and really build connections with them. We've nominated people to serve on National Quality Forum committees, and those committees review and participate in deciding what quality measures will be used for cancer care and other health care programs. And we've also nominated people to participate in the National Consumer Scholars Program and to attend the San Antonio Breast Cancer Symposium. So there's lots of opportunities if you're new to advocacy to participate in one of these programs, but most of the time they require a nomination letter, and we're happy to help with that. So if you ever see something either that we've promoted or that you see somewhere else but requires the support and recommendation of an advocacy partner, then you can just email us. Lindsay can help get a letter ready for you to include with your application for these different programs. We also often get approached by media for looking if a reporter is writing a story about a certain topic, they may be looking for a cancer survivor who's experienced a problem with surprise medical billing, or somebody who's had a certain type of cancer. And that's part of why we collect a lot of information about you when you sign up for CPAT, and we try to keep track of all of that so that when somebody asks us to try to find a survivor that might meet a certain criteria for either for media opportunities or other kinds of speaking engagements, that we can match you. So there may be times that you hear from us to say, would you be willing? We never would give your information to a reporter or to anyone without your permission, but if we have an opportunity come to us that we think you might be suited for, we can reach out to you and say, would you be interested in this? And if you say yes, then we make the connection. And so a couple of CPAT members have participated in a survivorship web series that Bristol-Myers Squibb has done called Survivorship Today. The website is survivorshiptoday.com, and they've gotten to meet with or film web interviews with Sterling Brown from This Is Us, which is kind of cool, and spend the day talking with him and being on set to film these web interviews. They've done a really nice job of highlighting a lot of the issues that cancer survivors face after treatment because they're very concerned about survivorship and have been really supportive of our work. So that's a kind of fun opportunity. Some of them are not quite as fun as that, but that's an exciting one. And then the other thing that I would like to mention is that we have the private Facebook group. So if you're not part of it, please join it, because that's where we can reach out if there's information that we want to share in between the CPAT Chronicles emails that go out once a month.
And we'll highlight some advocates who have participated in some of these opportunities a little bit later in the webinar. And like Shelley said, if you have any opportunities that you know of that other advocates might want to know about, we can definitely include those in the Chronicles, so keep an eye out there and let us know.
So next we want to share a little bit about the Cancer Survivorship Survey that we did this year. We conducted it early this year. We shared it with CPAT members, and I know a lot of you participated in the survey and shared it with your networks of people. We did this survey to really understand needs around cancer survivorship across a range of cancer patients, and look at some of the most frequent and severe side effects, where patients need help, and where are some of the gaps in care both during and after cancer treatment. So I wanted to share a little bit about what we found. We had almost 1,400 cancer survivors who participated. And you can see here the breakdown of almost 700 had completed treatment, and then the rest were still in treatment for either initial diagnosis or recurrence. And we also tried to understand how many had metastatic cancer and were treated with immunotherapies. We asked some of our partners and colleagues in the advocacy community to share this with their constituents as well. So we got respondents from a number of different cancer organizations that helped us sharing the information. So just a few of the high-level findings. And it probably won't be terribly surprising to you, but the great thing about this is that the data allows us to talk about it with a lot of different audiences that maybe aren't as close to this as you all are as advocates and cancer survivors, and may not understand these issues as well as you all do. So we heard from the patients who responded that there are many physical and emotional side effects, with fatigue and anxiety topping the list, and those as common long-term and also the most severe side effects. And that while healthcare providers are helpful at addressing the physical side effects like nausea and vomiting, they're much less helpful at addressing some of the other side effects that cancer survivors face during treatment: fatigue, anxiety, depression, and cognitive effects. This is something that we talk about a lot, and I can't tell you how many times I talk about this in an audience with healthcare providers, and they still sometimes are surprised by this. Their focus is on treating the cancer. And they do that well, but they don't always think about all of the other things that someone is going through at the same time that they're also being treated for cancer. And so having data like this helps us just give us data points to talk about, because the anecdotal stories are important and very powerful, but when you're talking with healthcare providers and policymakers, the data helps to show, there's a lot more to the cancer diagnosis than the treatment for the physical issues, and we're not doing as good of a job at helping cancer patients during their treatment with these issues, and also helping them afterward, which I think we're probably even worse at helping them afterward, but even during treatment, we're not helping patients as well as we could with some of these issues. When it comes to post-treatment information and care, few feel very prepared for the transition. If you look at how the people who feel somewhat prepared, it's a little bit better. But, of course, we would like for people to feel very prepared for the transition to post-treatment care. And it just highlights what we hear from you all and from cancer survivors consistently, that the first year after treatment is harder than treatment itself because of that transition. There's less support from providers and the care team, and you're sent off into the world to go forward after treatment and still unfortunately feel lost in transition. There is, the satisfaction with post-treatment care is varied. Some people say it's excellent, but most say that there's something to be desired in terms of the post-treatment care that they get. And then we asked about a range of issues in survivorship that people have, with financial issues really topping the list of both getting and keeping insurance and having financial support, showing really that those financial effects can be severe even well after treatment for cancer survivors, followed by managing the ongoing side effects, uncertainty about the future, and then having the energy to make it through the day. We also saw there was a disconnect between patient concerns and where they're getting support from healthcare providers, so that some of the issues that were most important to patients were the ones that were least, there was least attention paid by the healthcare team, and that patients felt that their team was that they were less likely to be helpful in those issues. So we are pleased to say that we're going to be conducting another survey next year, and we're working on developing what the questions will be, and we'll probably ask some of the same questions we asked this year to see if there's been any change, but also looking at some other areas of survivorship needs that we want to identify. So we will be doing that, and if you have ideas on questions you want us to ask in the survey, you can share them with us. And when it comes time to share the survey, we will ask you again to help us by both participating in it and also sharing it with your networks. And because we know that all of you are involved with other cancer organizations and have a network of your own advocates and survivors that you interact with, and you can share this information with them and ask them to participate so that we can get a really good cross-section of cancer survivors. We try to really make sure that we're reaching a lot of different types of cancers, different age groups, different parts of the country, different racial and ethnic mix. And we had a pretty good mix in this survey. It didn't 100% reflect the population of the 17 million cancer survivors. We didn't include children, and we didn't have as many over age 65 as we would like, and that we know is where the bulk of cancer survivors are, and just in terms of demographics. And we're going to be working to kind of oversample for older cancer survivors in our next survey to try to have a higher percentage of older cancer survivors so that we can really make sure we're fully understanding the needs that we hear from survivors across the spectrum. Oh, sorry, I forgot I had a couple more slides on the survey. I was thinking we were done. So this just shows a couple of the key side effects that were feeling overly tired and anxiety were two of the highest, rated the highest as most significant during and following treatment. And then you can see also that they were even higher among people who had income less than $50,000 or who were also on Medicaid. And then people reported 5.65 side effects on average per person. So these were, the dark blue line is during and after treatment, and then the light blue line is still experiencing these side effects. And then the last slide on the survey is about some of the patient quotes, "I wish I had known." And sometimes, here, even though you have the hard data, having some of the quotes from people is really helpful, that people wish they had more information about some of the long-term issues, fear of recurrence, long-term survivorship, people saying that they wish they understood that it was normal to have the kind of pain, fatigue, and depression that often come with cancer and fertility preservation.
Okay, so the survivorship survey that Shelley highlighted kind of, as she said, identified the gaps in care, and that equipped us with the information that we needed to then launch the Elevate Survivorship program. And that is a program that is a patient and advocate-led initiative, and the goal of it is to improve survivorship care at the local level by educating audiences about the need for adequate post-treatment survivorship care. Like Shelley said, unfortunately, there are a lot of audiences, providers included, who don't know that much about the specific needs that survivors face or issues that are really important to them. And so that's the goal of this program. And this year we selected 10 patient leaders to serve as Elevate ambassadors. And these advocates were chosen through an application process on our website, and then we provided training and support through in-person and virtual training sessions. And when these 10 ambassadors attended our in-person training in April of this year, they got one-on-one and group training so that they could execute a plan of action for a project that they had to improve survivorship care in their communities. And those projects vary depending on the advocate and the type of communities that they were coming from, which is across the U.S. And you can see there are some photos here of those like collaborations and the one-on-one mentoring that took place in those 2 days. And so this year's cohort of Elevate ambassadors had some really incredible project ideas, and I wish we could have time to run through all of them, but I did want to highlight one of our star advocates, Kim Richardson, and she worked with us as an ambassador to kind of bring to life this really amazing idea that would connect researchers and oncologists with patient advocates. And she called her program Survivors Advising Scientists. And she is working on ways that patients and caregivers can be more involved in the research process, and so that they can be trained on, the research, the biology, the simple, beginning baseline education, and then so that they can also go and connect in person and in other ways with researchers and oncologists. So this is there's a photo here of her giving a tour of a research laboratory. Those are patient advocates with her at a research laboratory at her cancer center in Illinois. And she actually said that during this tour there was a postdoc in the room, and he kind of pulled her aside and said, this is amazing. How can I, connect with you? And I would love to get involved in working with patients. I just don't know how to do that. And so now he's a big part of her project, and it's just, kind of speaks to the need for this work to happen and these connections to be made. And she's also launching a program called Surviving and Thriving, and she's completed after months and months of training, she is now considered she's a designated facilitator, so she's teaching self-management after cancer treatment at the University of Illinois Cancer Center. And so this is just an example of some of the amazing work that our Elevate ambassadors are doing, and we're really excited to work with the next cohort this year. So if you are interested in being an Elevate ambassador, keep a lookout on our website. And we mentioned earlier, through the CPAT Chronicles and through being part of the Cancer Policy and Advocacy team, you'll have access to these really cool opportunities, and we hope that you apply for them and engage with us and participate in these opportunities.
So just one more thing on Elevate. We're working on the process for applications for next year, and we'll share all that information, and we'll likely do a webinar in the early part of 2020 to talk more about the program. We can share with you what some of the other Elevate ambassadors, in addition to Kim, have done, and then talk about how you can apply for it. So keep on the lookout, as Lindsay said. We're excited to have the funding to continue the program and to have another class of Elevate ambassadors next year. And one of the things that was also really great about the Elevate ambassadors is that they really work together. And so some of what Kim was doing in Chicago was things that she learned from one of the other Elevate ambassadors here in Washington, D.C., who has a program to really introduce scientists to advocates to help impact their research. And so there's a lot of synergy among the different programs that the Elevate ambassadors are doing, and it's been a great learning experience working together with them. And so we look forward to bringing on some new ambassadors next year. So next I want to talk a little bit about, we've shared with you our Return to Functional Status project, which we actually renamed Redefining Functional Status. We last year won a grant from the American Institute of Research with support from Robert Wood Johnson Foundation, and they were doing a pilot project to implement principles of patient-centered measurement. And we submitted a proposal to work with a group of patient advocates to define what we would quality measures for functional status and returning to functional status after cancer treatment. We were the only patient advocacy group that was selected through this grant process, and it was a very competitive process. There were 3 other projects, and they were all academic medical centers that partnered with patients, but not actually patient advocacy groups leading the effort here. And so what we did was we brought together an incredible committee of 10 cancer survivors, and as well as a technical expert panel of oncologists and quality measurement methodologists. And we worked with, I'm sorry, the slides are advancing by themselves for some reason, so we're trying to, I'm sorry that they keep going back and forth. We're trying to stop them from advancing. But we worked with our committee to develop a conceptual definition of, we started with return to functional status. We actually, through the course of the project, changed that to redefining functional status. And we used this methodology called a RAND-Delphi methodology, which is a really detailed technical methodology of going through these long surveys asking about the importance to measure and the role that the care team can play in helping cancer patients with many, many different aspects of their lives and their care, to see what was important to this group of survivors, as that what should be measured, and how we should measure cancer care providers on the degree to which they're helping cancer survivors return to functional status during and after their treatment. And then we developed patient-centered measure specifications. So the next step with this is that they have to be developed into quality measures. But basically what we came up with is, here's what cancer survivors say is important to them to measure. And really what we learned, and we knew, but this committee really helped us see very, very clearly, and we're working on publishing and sharing this information so that people can benefit from the work that we did, but that patients want holistic care that recognizes the patient as a person rather than just a diagnosis, and helps a person live well with cancer during and after treatment. One of the key things that we did when we first got this committee together, we were really going to focus on after treatment. And the committee said, no, we have to look at during treatment. We have to look at during treatment for cancer survivors, whether they have a treatment of early stage disease or whether they have a metastatic or chronic cancer. That we can't just look at people who've completed treatment. So we expanded the committee, included some cancer patients who were still in treatment for multiple myeloma and metastatic breast cancer, so that we could really reflect a variety of different perspectives. And it was very important to the committee that we both look at that we develop measures that look at the patient's quality of life during treatment, and also that we really thought about how we talk about it, what terms we use. And that's where we decided as a group that return to functional status was really not the right way of thinking about what we're trying to measure here, because you don't return to normal after cancer treatment. You're redefining what that normal is for you, and so we decided to call it redefining functional status. But the important point that the care team is very focused, again, like we said before, on the cancer and not necessarily on how someone lives during and after their treatment, and that's where the functional status comes in. So what we heard is obviously that that cancer patients want an understanding of and help with the serious non-physical effects of cancer, and especially the psychosocial and financial. And then also team-based care that includes coordination among providers. It was really clear that, you know, what patients want is something that the oncologist can't necessarily provide all of this because there's not time. Their focus is on the cancer, but there's other members of the care team that can help with these other issues that are really important to someone as they're going through and completing treatment, so that the team-based care is really important. So going through this extensive process that included 2 long surveys that the committee members completed. We also had a 2-day in-person meeting and a lot of conference calls in between. But here were the prioritized outcomes: overall quality of life, including both physical and mental health, physical function, pain interference. This means the degree to which pain interferes with the functions of daily life. And same with fatigue interference. So how does fatigue interfere with being able to do the things that you want to do in your life? Cognitive function, and then psychosocial impact. So those were the outcomes that the committee prioritized that they wanted to measure. And then what we developed was a set of quality measures. Really what we decided was we can't just look at how somebody does during their treatment and after treatment, but we really want to make sure that the care team is asking about functional status. So we created a quality measure concept for even the assessment of these outcomes. So we know that people aren't always being asked about, I'm going to go back one slide, about these prioritized outcomes. So we said the first step is that we want providers to ask about these things. And we went through PROMIS, which is a large database of validated instruments for asking for patient-reported outcomes. And we chose, for each one of these, the PROMIS questions that the committee felt like were the best questions to address each of these prioritized outcomes. And so what we said was we want healthcare providers to ask about this at regular intervals during and after treatment, because the only way you can help somebody deal with their pain or fatigue or cognitive function is if you know that it's an issue. And if patients aren't bringing it up in their appointments, or if they don't know that they should be asking about it, then there's no way to help address it. So that's why at the bottom of this arrow, the process, the survey-based assessment of priority outcomes was the first measure was, are you as a healthcare team asking the patient about these issues? And then are you taking action when indicated by the survey responses? So if somebody has a very high level of pain interference, are you doing something to help them? And then we also specified some outcome measures of the experience of care, and this was really related to communication about side effects and late effects, and then the financial impact. Understanding the care team can't always fix the financial impacts, but can they communicate well about what the financial issues that people may be dealing with? So, and same with the late effects. The committee knew that healthcare providers cannot necessarily address every late effect that you may encounter as a result of your treatment, but can they communicate well with you about them so that you're not surprised by them and so that you know what you need to do to try to address them. And then finally, the outcome measures on the prioritized patient-reported outcomes. So back to these quality indicators, what we prioritize as outcomes. So if you measure how somebody's doing on physical function and pain interference at regular intervals, then the quality measure is what percentage of your patients are doing the same or better in these areas. So those are the measure set that we developed and said that this would be a meaningful way to measure how well cancer care teams help cancer patients deal with their functional status during and after treatment. So the next step is we have to get the funding to create the detailed quality measures that would actually could be put into practice, because we believe that measuring healthcare providers on these will help motivate change in practice so that these things are actually considered and dealt with in a way that helps patients' quality of life. So this was a really exciting project, and it was a long and difficult project, and these are the names of our incredible committee members who devoted many, many, many hours to this project, and really a lot of thoughtfulness and time and attention to addressing these really difficult questions. And it was a great committee that worked really well together. We asked a lot of them, more than we realized when we asked them to do it. I don't think they knew what they were signing up for, because we didn't know we didn't realize how much time it was going to take, but they never complained and were always very responsive and thoughtful, and really brought in the perspectives of a lot of other cancer survivors as well. They really did a great job of polling their community members and asking questions to inform their thoughts on these issues. So it was a great project. We're really proud of what we were able to accomplish and grateful to our committee members for their work on it.
All right. So now I'm going to talk about our 2019 symposium just really quickly. I was actually really sad to miss this year's symposium. Shelley said that it was one of the best ones yet, and I was at home with a 3-week-old baby, so I had a pretty good excuse for missing it. But this agenda was really exciting. We had a keynote from Dr. Otis Brawley on disparities in cancer care and outcomes, and we got to hear from 2 members of Congress on legislation for care planning, and I'm going to talk about that in just a minute. We also had a media training on how to tell your story, and, of course, we do training for Hill Day, which is my favorite part of the symposium and one of my favorite events of the year, where our advocates visited more than 80 House and Senate offices. And this year, our legislative ask for the symposium for Hill Day was for members of Congress to co-sponsor the Cancer Care Planning and Communications Act. We were really lucky this year with last year, our Republican main sponsor of the bill, he retired, and so we were looking for another co-sponsor to introduce the legislation with Congressman DeSaulnier, and Congressman Buddy Rogers stepped up to be the champion for this bill, and both he and Congressman DeSaulnier attended the symposium and talked to the advocates about why this bill is important to them. Congressman DeSaulnier himself is a cancer survivor, and so he is particularly really passionate about this legislation. And this act would establish a Medicare reimbursement code so that patients would get a care plan. I know a lot of times when I talk to people on the Hill about this legislation, they're like, wait, that doesn't already happen? And it is kind of crazy that it doesn't, because, helping patients by giving them a written plan or a roadmap, really helps promote shared decision-making between patients and their care teams. And we believe that it really empowers patients with, really important information to help them and their providers manage their care and to help coordinate their care as well. And so that is going to be also moving into 2020 in the next Congress. That's going to be our legislative, one of our priorities for the coming year as well. And I'm excited to, earlier, Shelley was talking about the many opportunities through CPAT to be engaged with research and different federal agencies on really important cancer care issues. And so I just wanted to highlight one of our amazing advocates, Winora Johnson. And she was actually highlighted in our last Chronicles. Each Chronicles, we have an advocate spotlight, and she is a 3-time cancer survivor. She's an incredible CPAT advocate. She's been with us for a few years, and this is her 3rd year of participating on the advisory panel on clinical trials for the Patient-Centered Outcomes Research Institute. That's a mouthful, but it's also known as the CORI for short. And so she had the opportunity to be involved in advising the research design, implementation, and technical issues of clinical trials as she served on this advisory board for informing clinical trials. So it's really an incredible opportunity, and these are the types of opportunities that we hope that we can connect our patients with. And so once again, just be on the lookout for more of those opportunities for patient engagement.
And let me just add one thing about Winora. She's going to be serving on the Cancer Standing Committee at the National Quality Forum starting in January, which I happen to be the chair of. But I'm really grateful that she's willing to do that. And we've nominated a few other CPAT members to serve on different committees there, including the Cancer Committee, but also Tamaya Eaton served on the Surgery Committee, which is obviously looking at surgery issues more broadly than just cancer, but she'd been through enough surgeries as part of her cancer treatment that she has had plenty of experience with surgery from a patient perspective. And I heard from the folks at the National Quality Forum that she did an incredible job in a committee room where she was one of only a couple of patient advocates and a lot of surgeons who were very opinionated. And sometimes, let's just say, physicians don't always want to be measured on things. They don't necessarily always want to hear what patients want them to be measured on. And she stood her ground and talked about what was really important from a patient perspective. So it's really important to have patient advocates in the room as these decisions are being made. And I'm grateful that you all are willing to do this kind of work because it's not always easy. Especially, quality measurement is really technical and not the easiest thing to do, but it's really important because it does shape how cancer care gets delivered because it's tied to payment in a lot of instances, and physicians are, very concerned about that, and they don't always want to be measured on the same things that we as patients and patient advocates want the healthcare system to do and what we want to see out of the healthcare system. So it's important for our voices to be there, and we're grateful for people like Winora and Tamaya and others who are willing to do that, and we're here to support you in any efforts that you're doing. If you're participating in some kind of advocacy effort and you need input or advice or support from us, just email us and let us know, and we will do whatever we can to help you.
And I added our emails here on the last slide. We don't need to tell you guys that 2020 is going to be a pretty crazy year. There's a lot going on politically, and then just legislatively with healthcare and the ACA, and there are a lot of other really pressing issues. But we want to make sure that we don't lose focus of what's really important to the mission of NCCS, and I know what's really important to many of you on the webinar right now, which is, improving cancer care, empowering patients, and so we kind of outlined some of the things that we've been working on and that we're going to continue working on and some of the new projects, but like Shelley said, we're always here to support you, and we're excited to continue to work with you into the new year.
And let us know if you have questions. You can use the chat box to ask them. I'll just, while you're, if you have any questions, go ahead and ask them, and I'll just add a couple of things. We are preparing for 2020, and a couple of things that a couple of webinars we're planning for early in the year in the first quarter is we're going to do one with a few of our CPAT members who are experts at using social media in their advocacy and have used it to connect with researchers and providers in a variety of different ways. Are going to do, we talked about this at the symposium last year and in previous years on using social media, but we want to do a webinar that really gives a lot of hands-on how to use social media, how to jump into these Twitter chats and use it as a way to connect with people, and then taking those connections offline and really developing relationships with with researchers that are active on Twitter, and then using Twitter when you're attending conferences. So we'll be finalizing the date for that and let you all know. We also wanted to do a webinar to talk a little bit more in depth about the Redefining Functional Status project. I spent a lot of time on it here, but I still just scratched the surface, and I'd love to have some of our incredible committee members be able to join and talk about the experience for them. So we'll be setting a date for that in early in the year. So another thing we're working on for 2020 is rebranding CPAT with a new name. And we have a bunch of ideas, and we would love if you have ideas on what we should call it that we could throw into the mix as we decide. We think that we could have a name that better captures what we do and what you all do, but we want you to be part of the process. So we're building a list, and so if you have ideas, send them our way.
We'd love to hear them.
And if we choose your name, we'll send you a little prize. We have, I do mean little. Yeah. But we have a few prizes around here that we could send you.
The Cancer Policy and Advocacy Team is too long.
It's a mouthful.
It is, yeah. So we're excited to rebrand the program and kick off the new year with an exciting advocacy launch. All right, if there are no other questions, thank you guys so much for spending your afternoon with us. And if you have any questions at all, feel free to email us. Our emails are on the last slide there. And we look forward to working with you in 2020, and we hope everybody has a safe and happy holiday next week.
And a Happy New Year.
Happy New Year.
Thank you, everyone.
Bye-bye.